I'm Dr. Wiśniewski, and you are watching channel Healthy for Long. Today I want to talk to you about how can you survive sudden cardiac arrest, or what can save your life during that situation, if that condition affects you. Every year about 350,000 of Americans are affected by sudden cardiac arrest, which means that almost every 90 seconds, one American gets affected. Unfortunately, 60 to 70% of those people die. Does it have to be like that? The answer is no. We have solutions to prevent that death or to make that situation better, in the sense that you can get to the hospital and get needed help. But first, let's define what is sudden cardiac arrest. Sudden cardiac arrest is a situation in which heart stops effectively pumping blood with oxygen to your tissues, such as brain and other areas of your body, as a consequence of severe arrhythmia, usually very fast heart beating, irregular heart but very fast heart beating, which makes impossible for the heart to get refilled with the blood and then subsequently pump that blood to your tissues. What are causes of sudden cardiac arrest in people? So there are various causes. The most common are congenital heart diseases, arrhythmias, which is a name for irregular heartbeat disorder, coronary diseases, and cardiac valvular diseases. Valves are like a small doors opening when it's needed between chambers in our hearts. But in 50% or more of cases of cardiac arrest, there is no history of, or no past medical history of previous conditions like I just mentioned. But many times when sudden cardiac arrest occurs, those people will be diagnosed with one of those diseases. So, what are symptoms? Person who is affected by sudden cardiac arrest usually collapses immediately to the floor or loses consciousness. Those people most of the time stop breathing or start gasping. Gasping is a name for irregular, very infrequent attempt to breathe. Those people are unable to talk, to answer your questions. And if you check for pulse on them, and just to remind, you can check for pulse on the neck, on the side, or near the wrist on radial artery. I will talk about that in the future. If you check for the pulse will be absent or very weak. So you may ask, how can we help those people? What can we do? So the sequence of steps that you should undertake, it's almost always the same for people who have sudden medical condition encountered on the street. You call 911, you start CPR, and you find out if there is availability of AED. AED stands for Artificial External Defibrillator. This is a piece of equipment, this is a machine that I want to talk about today, because this machine may help or may save your life if you are affected by sudden cardiac arrest, or one of your neighbors, friends, or passerbys on the streets are affected by that. You might have seen sometimes boxes with red cross hanged on the walls in libraries, in airports, in casinos, in public places. And those boxes many times are AEDs, are those pieces of equipment that may save your life during cardiac arrest. How do they do that? So this AED can provide you a shock, electric shock, that revives normal, regular heart rhythm in your body when it's needed. But of course, there are certain steps that you have to go through to provide that shock. However, those machines usually provide you step-by-step instructions guided by voice coming from the machine. You just have to power that machine on by pressing the power button, and then that procedure will start and the machine will be telling you what to do step by step. Ideally, would be if you can get a training in providing first aid, and that training would include how to provide electric shock using AED. But even if you never went through any type of training, most likely you will be able to provide this shock effectively. Now you may ask why I am putting so much importance on using this machine in victims of sudden cardiac arrest. I'm doing it because there is a lot of evidence that time matters, and it's almost never enough time for EMS, for ambulance to come to the victim to provide electric shock if this condition affects you on the streets or somewhere in public places. I want to provide you with some evidence proving that fact. So first of all, there was a study conducted and that reviewed time at which we provided electric shock and survival of those victims. And it's been estimated that with every minute when victim suffers from sudden cardiac arrest, with every minute passing, the likelihood of their survival decreases by 7 to 10%. So after 5 minutes, their survival chances decrease by 50%. That's a lot. There is another study that looked at 14,000 cases of sudden cardiac arrest. And they looked at people who didn't receive any help. They looked at people who received only CPR, so just standard pressing their chest to pump the blood from the heart by compressions, or another people who received also defibrillation. And the results were astounding. People who did not receive any kind of CPR survived only in 7% of cases. People who received only CPR but without electric shock, only 9% of them survived. And people who had cardiac arrest and electric shock from AED was provided, up to 38% of those people survived. So you can clearly see the benefit of electric shock provided using AED. Another study was conducted comparing electric shock provided by EMS when EMS came to the scene, and that was compared to the group of people who had cardiac arrest in places where electric shock was provided by bystanders. So that means that AED was probably available in library, in the airport, in casinos, or in other places. And again, the benefit was much better when AED was available locally. When electric shock was provided by EMS, only 43% of people survived. When electric shock was provided by bystanders because AED was available on site, up to 67% of people survived suffering from cardiac arrest. And finally, another study was done in casinos. Casinos started very early placing AEDs in their locations because there are a lot of old people coming there, and also sometimes they go through very stressful situations, losing or winning money, and they suffer from those conditions. So they compared timing of delivery of electric shock to them, and they determined that if electric shock was provided within 3 minutes of occurrence of cardiac arrest, 74% of people survived. If that electric shock was provided beyond 3 minutes after sudden cardiac arrest happened, only 49% of those people survived. So again, clearly we see importance of timing of delivery electric shock when person suffers from cardiac arrest. So to summarize, a lot of Americans may suffer cardiac arrest during lifetime, and every year we have up to 350,000 of Americans suffering from sudden cardiac arrest. Their survivals depend strongly on availability of electric shock and AED, artificial external defibrillator availability on site. So it is very important. You should familiarize yourself when you go to public places such as libraries, airports, casinos, country clubs, and many others, where that AED is located. Usually it will be there. If you find out that AED is not available at the place where you go, let's say in local gym or somewhere else, you should inquire managers. Are they planning to do it? Or maybe you can help them with raising funds to do it, because one day it may save somebody's life. At the same time, I encourage you strongly to get trained how to provide first aid. If you've never been certified in providing first aid, and anybody, any lay person, without any kind of professional medical training can get trained how to provide first aid. I encourage you to call fire station, police station, or go to the website American Heart Association, and you can find out where you can get trained. It will be available, I am sure, locally where you live, in your town, in your village. So I encourage you strongly, get trained, because you will be better equipped and you will feel more comfortable to provide first help to people who need it. That's all for today. I'm Dr. Wiśniewski, and be healthy for long. Until next time.